Hi, my name is Katie. I'm an occupational therapist and a lymphedema specialist. And I get this question a lot in the clinic and from people online. And it's, what do you think about dry brushing? And can I do dry brushing instead of doing manual lymph drainage? So my answer may surprise you, but I don't recommend dry brushing very often. And here's why. When we're doing manual lymph drainage, we're moving the lymphatic fluid. And just to kind of go a little bit deeper into that, the lymphatic fluid is very thick. It's made up of proteins, water, blood cells, and fat. And so we're moving that fluid to the lymph nodes that drain that area of the body. So in the clinic, I tell my patients, as long as you know where you're moving the fluid to and you do it properly, you're good when it comes to manual lymph drainage. It's a very light technique. It should never hurt. All the things that we teach you over and over from lymphedema specialists. But when we do manual lymph drainage, we can really decrease the fluid. As a therapist who I've been doing this for a long time, I can sometimes feel that fluid move. And it's quite satisfying on my end because I can feel the fluid move where it needs to go. And afterwards, I know the patients are going to feel so much better, whether it's after cosmetic surgeries, whether it's after lipedema reduction surgeries, whether it's through oncology treatments, whether it's lymphatic wellness. That is the big takeaway, is manual lymph drainage can work for everyone. And I also get that asked often is, how often do I do it? I do this for a living, so I don't go home and do it as often as I should, but I definitely do it when I don't feel well, or if my kids start saying my throat hurts. That's a great time that I step in and use my skills. So going back to the lymphatic system, is that fluid is thick. It needs to move to where the lymph nodes are, and manual lymph drainage speeds up that process versus our bodies doing it naturally. When I teach manual lymph drainage to my patients on what to do at home, I tell them the sequence to use, and that way they know all the different steps, because that makes a difference. But here's what we're here to talk about, and that's dry brushing. And I am not a big fan of dry brushing, and there's a few reasons why. And I brought my dry brush in just so we could kind of see it. Dry brushing can be very stiff. It can be very firm, the bristles of the brush. If you have lymphedema, we are very cautious about your skin integrity. We do not want any, even microscopic tears to that tissue, because a little bit of bacteria gets in and that could lead to infection. So a lot of dry brushes, in my opinion, are too firm. I don't want that scratching my patient's tissue and that leading to an infection. So there's number one reason on why I don't recommend dry brushing. Number two, and this is another big one, so this is for my people who have lipedema, my people after cosmetic surgeries, and my wellness. I don't think it does a great job of doing manual lymph drainage. When you use a brush, and it could be circle, it could be square, are the typical brushes you'll see, but if you can see in the video, and I'm going to kind of slide this around here, and if you can see that space, a dry brush does not contour to our tissue. So it is natural to have grooves and dips in our tissue, and a dry brush cannot censor that groove that it's coming along. So it's not a custom manual lymph drainage. So when I teach patients how to do that, I recommend using your hand. When we use our hand can contour to our body, and it can move and stretch that tissue to move the lymphatic fluid. It can feel how the body feels, so it knows how to lay on the body. So that is the biggest reason. However, I do have a few patients where I'm like, okay, for you, dry brushing I do recommend. And here are those patients. Those patients are the ones who say, my hand hurts, my wrist hurts. It hurts when I'm reaching different parts of my body. And that is a good reason to use a dry brush. I think of it as an adaptive tool. It can lengthen, whether it be the arm, the wrist, so that we can reach different parts of our body, especially the ones that have a long brush on them. That can be helpful. Number two, it's in a part of my body I can't reach. So a lot of people I see that have liposuction on the back, and it's like, well, it's hard to reach back there, and sometimes we want to soften that tissue. So when we're doing dry brushing with an extended brush, those people can reach where it needs to be reached, and they can't do it with just their arm and their hand. So that's another instance that I would recommend dry brushing. So in conclusion, dry brushing isn't bad, it's just not something I prefer. I think using your hand is the better method to decrease risk for infection for people who have lymphedema. Number two, it gives you a custom fit when you're doing manual lymph drainage. On the flip side, there's always another side to the story. I do recommend dry brushing when it is appropriate. So when my patients are saying their wrist hurts, their fingers hurt, their hands hurt, that's when I'll say, okay, let's think about dry brushing, maybe get an extended brush so that you're not having to stretch and reach and causing that pain. As well as if we need to reach a body or a part of the body that we need to soften, we need to do some manual lymph drainage on, I will recommend maybe try a dry brush with the extended handle so that you can reach back there. But when it does come to manual lymph drainage using a dry brush, if that is something, either it feels good to you, you are in one of those categories that I recommend it for, you still use the same sequence as what you would do with manual lymph drainage. So it's not appropriate to start at the hand, it's not appropriate to start at the feet. Use the same sequence that you do for manual lymph drainage, because that is a tool to help the manual lymph drainage sequence to properly drain, get the most benefit from manual lymph drainage. So if you found this beneficial, please subscribe to my YouTube station or channel, and that way you will be updated when I post new videos, as well as please be aware I have made a few virtual courses on not only how to manage lipedema at home, but also how to do cupping at home. So if you're interested in that, please check my profile on YouTube or reach out to me with any questions or messages.